join PMMC in our webinar series. Today's topic is successfully outsourced denial and underpayment recovery. Today's speaker is the Director of Revenue Enhancement for PMMC. Robbie Shaw has experience in all aspects of collections, and he leads our recovery department here at PMMC. A couple of housekeeping items I'd like to cover. We like to keep these sessions interactive, so we're going to be asking several poll questions throughout the session. And if you do have any questions, we'll be taking those in the chat box, and we will be saving the questions until the end. But if something does come up and you'd like to ask, go ahead and put it in the chat box, and I will save it for Robbie at the end of the session. So with that, I'm going to pass it over to Robbie Shaw.
All right, thanks, Brad. As Brad mentioned, my name is Robbie Shaw. I'm the Director of Revenue Enhancement here at PMMC. I've been within our recovery department for the last 6 years, working with several organizations on improving their financial performance through underpayment collections. And what I'm going to share with you today is going to be nothing new and nothing you've never heard before. It's really designed to get you to start thinking about what you're currently doing, what you may need to do as we enter into the new year. We're going to start off today with asking a quick poll question. We'd like to know how much your facility or facilities are currently collecting in underpayments annually. If you would, enter your responses into the chat box. That way Brad can kind of keep track of them a little easier. Again, all of your responses to the poll questions today will be kept confidential and not shared with anyone outside of PMMC. So if you would go ahead and do that, I would appreciate it. I'll just give you a little bit of time to go ahead. Again, I didn't mention this, but if you don't know exactly what it is, if you just enter a ballpark number, that will help. We're going to apply that to an industry statistic and see how everyone on the phone kind of compares as an average. All right, so moving on, what we're going to cover today, we're going to give you a brief introduction to PMMC, who PMMC is. We're going to talk about underpayment statistics and how large the issue is across the industry. We'll talk very briefly about the evolution of payment terms. And then we'll get more specific into what does success look like when you're looking at underpayment collections and using a vendor to help you manage that process. Once we get through all the material, we'll open it up to questions. If you have questions throughout the presentation, feel free to go ahead and enter those into the question box, and that way Brad can make sure that they are asked at the end of the presentation. All right. As a brief little introduction into PMMC, if you're not familiar with us, our mission is to continuously improve the financial performance of healthcare organizations through high-value revenue cycle software and services. We were founded in 1986, so we've been in the business about 30 years. We've been ranked among the top 10 revenue cycle firms for the last 4 years, going on 5 years coming up. Between our contract management system and our recovery service clients, we're generating about $150 million or more back into the pockets of our clients. And across all our various product lines, we're generating about an 800% or more return on investment to our clients as well. So for every dollar they spend with us, they're getting at least 8 in return. All right, one of the things that makes PMMC unique is our contract management system and how we're able to leverage the calculation engine across all our different platforms. It helps us with accuracy to know exactly what you as the facility should be reimbursed. We use it in our price setting systems, and we use it also in our front-end patient estimator tool. And then again, we use it in our recovery services department to make sure that we're collecting every dollar possible. When we look at payment terms across the industry, prior to 1965, it was very simple. If the patient needed healthcare services, they went to the doctor, they got treated, they received the bill from the doctor, and they paid the doctor. It was a very simple, straightforward process, whereas today, and this is a simplified view of what today is, if the patient needs healthcare services, they call, they get authorization, they get approvals, they get a referral to the doctor. The doctor then assesses the patient and develops a treatment plan, then calls the insurance company to make sure that the authorizations were received. They document the coding, then they send out the bill to the insurance company. The insurance companies decide whether or not they want to pay it. If they do want to pay it, how much do they really want to pay? Inevitably, it's never correct. And we go through this kind of circular process until the claim is finally paid correctly. As we continue into the future, these terms, these contracts are only getting more complex with the introduction of ICD-10 and the bundling initiative introduced by Medicare this year. We're seeing it get even more complex, and if you were to look at what the system's going to look like next year, I'm sure there's going to be lines all over the place and a very hard chart to understand and see and try and figure out what's going on. Some industry statistics, looking at where most hospitals are getting their revenue, 60% of it is coming from Medicare or Medicaid, and the other 40% is either coming from self-pay or commercial payers. Looking at how big the underpayment problem is across the industry, our estimates run from 1% to 4% of net revenue, and some of the AMA surveys out there suggest that 62% is the payment accuracy level of payers. If you look at just Medicare, Medicaid, and Medicare Advantage, they estimate their payment accuracy is closer to 90%, but that still represents about $70 billion in incorrect payments a year across those three payers alone. All right, so if we were to take those same statistics and apply them, hang on one moment, and apply them to, and apply them to what an individual hospital is receiving. If you take a hospital with $500 million in gross patient revenue, assuming a 50% contractual write-off, that leaves you with $250 million in net patient revenue. If we're looking at just the commercial payer mix, about 30%, you're looking at $75 million in contractual write-offs for the commercial payers. If we take the most conservative estimate of 1% of claims underpaid, you're looking at $750,000 in likely underpayments. When we asked how much you're collecting, when we asked earlier how much you're collecting currently every year, the estimate that we received from everyone was about 2% of net revenue. So that number would be double using your numbers today. If we're looking at, of that $750,000, how much is collectible for underpayments, that brings it down to a 40% collection rate, which represents about $300,000. And when you're looking at how much you pay your staff or how much you pay the vendor, what that really means is that's a $210,000 bump to your bottom line. We're going to ask another poll question at this time. If you would, Brad's going to send out a a poll. If you would, please respond.
And we'll give it about 30 seconds here for all the responses to come in. If you would go ahead and select an option. All right, well, it looks like mostly everyone has voted, and it looks like 75% of the audience currently is utilizing a third party for underpayment collections, and the other 25% responded that they are not currently. So thank you for voting.
Great. All right, so as we go forward, we're going to look at what are the key requirements that you should be looking for out of your underpayment partner or vendor. The first is you really want them to be an extension of your patient accounting system and your current processes. You don't want them causing a lot of disruption or stepping on a lot of toes and getting in the way. So it's important to look at their processes and make sure that they're not requiring too much or getting involved too much in what your current processes are. The second is you want to ensure that you are getting the appropriate payment for services provided. So it's important that your vendor is able to verify the reimbursement accuracy on all accounts and recover the identified lost revenue on all accounts, including closed accounts and open accounts. You don't want them limited to just accounts you've determined are closed and uncollectible. You really want them looking at all accounts to make sure that any open account that hasn't been touched in 60, 90, 120 days is getting appropriate attention to make sure that you're collecting all dollars possible. You want them to really be an industry expert and have experience across multiple payers, multiple states. I can't tell you how many times knowledge we've gained in, say, Texas applies to another state like in Tennessee. That helps us collect from various payers. And as the insurance market becomes much more nationalized, the experience from state to state becomes even more important. And you also want them to be offering some insights into the trends that they're seeing and the areas that you can correct and prevent those underpayments from occurring in the future. And lastly, you want them, of course, to be providing you financial results. You want them to be increasing your profitability without you incurring any additional overhead. So you really want them to operate with you, but also behind the scenes. You don't want to spend a lot of time, a lot of resources helping them collect money. You really want them to be able to go collect money and identify money on their own. All right, we're going to pause for another poll question. If you would please answer how many people you currently have working underpayments or denials on your team. We'll give it probably about 30 seconds for everyone to respond.
Okay, it looks like most people have voted. And okay, the results are 60% of the audience has 1 to 2 people, 20% of the audience has 2 to 4, and another 20% has more than 5.
Okay, great. All right, and we're going to also ask another question. real quick is how many accounts can an individual collector effectively manage? If you would please answer that question real quick.
We still got a few votes coming in, so we'll give it another few seconds here. If you would submit your response to this poll, we would greatly appreciate it. Okay, in response to this poll, 40% of the audience said that they have, or that less than 100 accounts can be managed. Another 40% said between 100 and 200, and the remaining 20% said 300 or more. Thank you for voting.
Great. So when you're looking at a vendor, the first thing you need to do is figure out what you need and what your current collection processes are. So a lot of the questions we're asking here are the questions we asked a minute ago, or tied directly to it. So when you're evaluating your collection process, the first thing you want to do is define what is effectively managing an account look like. Is it calling or following up on an account every 3 weeks? Is it every 4 weeks, 45 days? What do you define as effectively managing an account? The next is you want to look at how many people do you have working those accounts, and how many accounts can those people effectively manage. So if you want them calling every 2 to 3 weeks, they can manage very few accounts. If you're looking at them calling once every 45 days to 60 days, they can manage a little bit more. The next is how many accounts are out there. If you have 1 to 2 people and they can manage 150 accounts apiece, and if you have more than 400, 500 accounts at a time, you're really limiting how much potential you can collect or effectively manage. So it's real important to look into what your current process is, what your current volume is, as well as how many resources do you have at your disposal to work those variances effectively. The next is, if you have too many accounts out there and not enough people to effectively manage them, what accounts do you want those people working? How long should they hold on to an account? You may have a $50,000 variance and you want them to work it for 6 months to a year until it's no longer collectible or collected. But it may be a $1,000 variance that after 6 months, you know what, it's not worth their time. They need to start looking at something newer and something more collectible. This is just like traditional AR, to where the older it gets, the less likely you are to collect it. So it's important to start defining what those parameters are. And as you go to look at a vendor, you really want them to fit into the process you currently already have. So it's important to define that process ahead of time. Once you've defined that process, you can start looking at what options are there for partners to work with you. On this slide, we have a few different options that most of our clients are currently using. We have first dollar recovery, which is where your staff is focused on getting the claim adjudicated or paid initially. Once the claim is either paid or denied, the partner or vendor you've selected goes and picks up that account and works it to ensure that you are getting paid accurately and fully. The other is more of a second dollar safety net type of option, where your staff is focused on not only getting the claims adjudicated, but also identifying any underpayments and collecting those underpayments. To an extent, you may want them focused on the higher dollar stuff and let the the vendor do the lower dollar stuff, or you may want them grabbing as much as they can and collecting as much as they can, and then the vendor coming behind and collecting what they weren't able to handle or what they didn't identify. Both the first dollar and the second dollar approach are more of an ongoing approach in the sense that the vendor is constantly looking and auditing behind your team so that nothing gets into the timely filing bucket. So the vendor is constantly receiving your data, and whatever that day threshold is, that if an account hasn't been followed up on in 60 days, or if the account hasn't been touched in 90 days, whatever that threshold may be, the vendor is looking at it at that point to determine if there's more any additional collection opportunity. The third that we have up here is more of a project-based, which works pretty well. It's where the vendor takes a set of data, typically 6 months to a year's worth of data at a time, and churns through that data to determine if there's any additional collection opportunities. I've warned people against relying too heavily on the project-based, because as timely filing deadlines shrink, the opportunity for collection under this model significantly decreases. I'll give you an example where in New Mexico, their timely filing guideline for their Medicaid product is 90 days. If you're waiting for a 6-month process or even a year process to audit those claims, you're leaving a lot of money on the table, because after that 90-day mark, most everything's uncollectible. So you'll end up having to write those off, even though you're due that additional money. These are just kind of an overview of what our different models are. It's important to know that just because you want a first dollar recovery with underpayments doesn't mean you have to do it with the denials. You can kind of blend these any way you would like when you start working with your partner. If you want them picking up underpayments from the day of underpayment and your team focused on the more collectible denials, that's another option as well. The next thing, once you identify what you need and what process you want the partner to go through in terms of first dollar, second dollar, or project base, you need to really clearly define what rules and what your partner can work with. You need to define what pairs they can and cannot work. I can tell you that I've had clients come to me and say, on our first call, you better not do this with Blue Cross, because that's why we got rid of our last vendor. Those types of things are very important and very helpful to make sure that the vendor is truly doing everything they can to help you and nothing to get in your way. So if you've already identified a large underpayment issue with Aetna, you don't want them working it. So it's important to specify that up front so they don't go work it and expect to get paid from it, even though you did 90% of the work already. The next is to identify how long should the vendor wait before picking up an account. What are the rules of the accounts they can work? Say they're allowed to work this type of underpayment. When can they pick it up? Do they pick it up from the day of payment? Do they have to wait 30 days from the day of payment? Or do they have to wait until no one on your team has followed up on it in the last 60 days? So it's something you're truly not actively pursuing, but you give your staff all the opportunity to collect it before the partner or vendor gets involved. The next is how to identify what accounts the vendor is working so that your staff doesn't start working the same accounts, or the vendor isn't working the accounts that your staff's already working. So the notation of accounts and the requirements for notating accounts within the patient accounting system is very important to prevent the duplication of efforts, and also that natural friction that would develop if both of you are working the same accounts. For us, the way we handle our process is we'll make one note in the patient accounting system when we pick it up, and if the client decides that we shouldn't have picked it up, they can let us know and we'll talk about it. But that's kind of the indication that we've picked up the account and we've begun working it. The next is what type of follow-up practices should they have? How often should they be calling on an account? How aggressive should they be with the collections? Is there a provider rep you absolutely do not want them to go talk to if there's an issue? Should they only be working through the normal customer service channels? Do you want them doing any type of generic collections with letters, or are they doing any generic collections? We've identified a couple vendors that all they do is send out a letter. They don't make a phone call to follow up on the letter to the payer. All they do is send out 2 or 3 letters, and whatever sticks, sticks. They don't do any type of follow-up. So defining what follow-up they are actually doing is important. From our perspective, we see it best to follow up on an account and actually pick up the phone once every 3 weeks at a minimum. And the final kind of most important piece is the reporting and the feedback loop that you create. With the reporting, everyone's seen, probably gets from their vendor, if they have a vendor, a similar report to this where it's very generic. It's a great high-level CFO report where it says, okay, well, how much are we collecting? Where are we collecting? What are the general reasons we're collecting? What's out there in the pipeline? What are we still waiting on? And that sort of thing. So this is a great high level, but it doesn't do anything to tell you, okay, well, Medicaid has an authorization issue. What's going on with Medicaid? How do we prevent that going forward? So it's important to start looking at, beyond just a summary report, a root cause analysis. How can we identify the issues, and then how can we fix those issues going forward? Are they authorization issues where the upfront authorization team is not calling and getting the authorization? Is it a billing error that we can change the bill scrubber so that they no longer occur? Or is it a payer system that we need to go to the provider representative and say, hey, look, you have this rate in the system wrong. You need to update it so we don't have to collect on these in the future. I'll say it multiple times that this process is really designed to work the vendor out of a job, in the sense that if they find an issue or if they find a repeating issue, they should be helping you fix that issue so it no longer occurs and so that they no longer collect it for you in the future. Now, let's be realistic. You'll probably never work your vendor out of a job because Aetna is going to always find a new way to not pay you correctly or not pay you at all. So there'll always be a new trend for them to identify or help you with. But for the items they've identified, they need to be helping you resolve them and prevent them going forward. So here's a sample report of what we've started providing to our clients. You can see what contract it specifically impacts, what the general reason is for it to be underpaid. But the important thing is that you can see why are they picking it up in the first place. So on this, we label it the first comment report. And what this is literally the note that my reviewers, my auditors are given to our collectors to go pursue. So this is the information that our collection team is calling the payer and saying, hey, Blue Cross, this claim hits our $99,000 stop loss. Why aren't you paying our stop loss rate? You need to pay our stop loss rate. Or, hey, Blue Cross, we got this authorization, but you're denying it for no auth. Why are you underpaying it? So this really allows you to look at the accounts we're collecting on and identify the real initial reason for the underpayment and how we're able to collect on it. What this does is it helps you say, if there is an authorization issue and they did not get the authorization routinely on this one code, you can go back to your internal processes, fix it so that you then get the authorization going forward, and these underpayments and denials no longer happen. Moving into next year, what I would really recommend everyone to start doing is looking at what your current process is. What are you currently working on? How many accounts do you have to work? How many people do you have working the accounts? And where do you need help? Identify what you would like the partner or vendor, whoever you select to help you with. What do you want them working? And more importantly, how do you want them working the accounts? And then the biggest thing you need, if they're not already providing it for you, is to create that feedback loop to continually improve your process and make sure that those underpayments and collection and denial collections are prevented from even needing to happen going forward. So that's, as we go into the new year, that's what I would really encourage everyone to do. If you're one of the ones at the beginning that answered that has a underpayment collection of less than 1% or less than 2% of net revenue, it doesn't mean there's more out there, but it certainly is a suggestion that there may be more out there, and it's worth a double check. So with that, I'd like to open the floor up to any questions that anyone has. If you would, please go ahead and send those to Brad through the question box. I'd be happy to answer any questions you have.
Thank you, Robbie. We do have a question here for you. How many calls does it usually take to get an underpayment paid, or how many notifications to the payer? Is there a magic number for that?
There's not necessarily a magic number. I would say on average, our collection cycle takes about 45 to 60 days for an account to be collected from start to finish. And our process is to call once every 3 weeks. So with that, on average, we're seeing all of our collections come within three to four contacts to the payer to ensure that they're processing it correctly.
Great, thank you. The next question we have is, what kind of collection percentage rate are we getting on the findings?
Okay, that kind of varies depending on what approach you take. If you take kind of a first dollar approach where the partner or the vendor is doing all the work, our collection rate's actually pretty high. It's close to the 75–80% collection rate. So out of all our findings, we're collecting about 75 to 80%. If we're doing more of a retrospective audit behind your team, a lot of times that collection rate drops for various reasons. Some of it due to timely filing, others due to a variety of different reasons, or it may be just a harder item to get collected, but that collection rate drops to about 40 to 50%.
Okay, thank you. New question for you, Robbie. How many accounts does each collector own within PMMC's recovery department?
So our collectors are managing routinely between 200 and 300 accounts, and churning those accounts probably every 60 days. It's kind of refreshing.
Okay, great. And I think at this time we'll have a last call for any final questions for Robbie. So if you do have a question, please go ahead and enter it in the question tab. All right, well, we do have one final question for you, Robbie. In your experience, what are some of the reasons that payers will give for not paying an underpayment, and how do you get around those?
The most common reason that everyone hears, and it's not a very helpful reason, is claims paid correctly. That's somewhat of what we take as an unacceptable response from the payer. If we ever hear that, we're really trying to push the payer to tell us why they think it's paid correctly. A lot of times it's not actually paid correctly. Other reasons are just kind of the variety of reasons, from COB denials to the claims not billed correctly to just general contract interpretation issues. A lot of times, if you look at the bigger payers, the Blue Crosses across the nation, when you have them reprocess a claim, all they're doing is sending it through the same calculation engine to tell you, yes, nothing's changed on the claim, it's still the same rate that you should be receiving. So it's a variety of reasons, and there's no real golden nugget or in terms of the bucket to go look for, but the key is not taking what the payer says as gold, I guess. If they say it's paid correctly, that doesn't really mean it's paid correctly.
Okay, thanks. And we did get one final question here for you. What is your success rate on accounts billed timely but no follow-up for more than 12 months?
It varies. If it's a state that has, say, Texas, for fully funded accounts in Texas, you have 4 years technically to fight those. Tennessee is 18 months if it's a fully funded account. So it really depends on what the state laws are. I would say if it was billed timely, if it was denied, if it was inappropriately denied as untimely, in that case, you have a very good chance of collecting it. If it was billed timely and just underpaid, that chance decreases significantly. But I would say, and this is not with the real statistics behind me, in the sense that I've never looked at that number. But if I had to guess, I would say at least 20 to 30% of them that we've picked up have been collected, even though it's timely. Even though it's truly timely, if that makes sense.
That does. Thank you. All right, well, with that, we have no further questions. So I think we're going to go ahead here and wrap up. Robbie, I'd like to thank you very much for your time today. And
Great.
thank you.
Brett,
did you have any closing thoughts?
Well, I was going to flip the screen and share my contact information. If anyone has any other questions they'd like to ask after the call, feel free to email me or email Brad. My phone number is also up on the screen, and I'd be happy to answer any questions or talk with you about anything you're currently thinking about.
All right, great. Thanks so much, Robbie. And thank you to all the attendees for joining us today. We will be sending out a copy of the slides along with the recorded session within the next day or so. And if you do have any questions, feel free to follow up with either Robbie or myself. Thanks again.
Thank you.